Hi, I'm Irvin from Resilience Occupational Therapy. In this video, I want to talk a little bit about back sleeping. Now, side sleeping, in another video, we discussed some of the challenges with it, with your shoulder, your neck, and your back. And back sleeping does have the potential to be a less strained position for you while you sleep. But there are some considerations. For one, you don't want to sleep such that your hands are behind your head. It might feel like a nice comfortable position to begin with, but as we discussed in the other video, your arm is extended. Your joint is at its sort of end point, and you don't want to be resting there. You want to be resting in a more neutral position. So you get a pillow, or maybe no pillow at all, depending, that gives you the most neutral support to your neck. So usually a thin pillow if you're back sleeping. And you can rest into there. Now there are Tempur-Pedic pillows and curves that you can have so that you can maybe roll up a towel. There are other supports you can give when you're back sleeping. But we'll focus primarily on just not having your hands behind your head or behind your neck, because that's going to give you shoulder problems eventually. One more thing is this position seems like nice and straight and neutral, but really my knees are extended here, and that's actually not the best place for my back to be in. This is more of a neutral position. Many of you who have received body work from me know that when I'm having you lay on your back, I often want you holding your knees up like this. But holding your knees up while you sleep, not the easiest thing to do. So that's where you either have a thicker pillow like this, gives a nice neutral curve to the back. Or if that's a little too much for you, you can ball up another pillow and just get your knees bent a little bit. Play around with what works for you. And of course, I know it's tricky that if you're someone who switches between your back and your side while you're sleeping, that what's ideal for your back here might be really uncomfortable for your side if you switch there in the night. So it's complicated, but if you're having a particular problem with your back or your neck or your shoulders, and you tend to be a back sleeper, these are some considerations for you.